Hi, my name is Olivia Presson. I am a senior nursing student at the University of Missouri St. Louis. I'm on track to graduate this May of 2021 with my BSN. A little bit about myself. I am currently completing my senior capstone hours at Mercy St. Louis Hospital in their labor and delivery department. I am thoroughly enjoying that. I really think that labor and delivery is my biggest interest this far, and I'm pretty passionate about that. I'm currently employed at my family's barbecue restaurant, but as a server, but I have 6 years of customer service experience since I was able to work essentially. And I recently just completed an internship with SSM. Uh, I was on a medical oncology floor and I shadowed a nurse. I learned a lot about a nurse's day-to-day activities and skills. So that was really nice. This seems like a pretty stressful time for me, but I'm so excited for what these next few months have to offer. There are several reasons why I chose to be a nurse. First and foremost, I've always loved my anatomy, biomed, physiology classes since high school. I've always been super interested in that. Like I said, I've been working in customer service since I was 16, and I've really grown to love working for people and working with people and meeting others' needs. I think I consider myself somewhat of a people person. And lastly, the main reason I chose to be a nurse was when my grandma got diagnosed with cancer when I was still in high school. Um, she went through chemotherapy and radiation, and she was pretty miserable. She was not herself at all. She's usually very fun loving, very funny, witty. She was not that whenever she was going through her treatments. So one day I decided to go with her while she was receiving her chemo. And I was so impressed by how kind, how witty all the nurses were. They were the only ones that I knew that could make my grandma smile while she was going through her treatment. And I really thought that that was a very beautiful thing to be able to touch someone's life while during such an adverse time in their lives. So that's ultimately why I decided to be a nurse, so that I could make a difference in someone's life while they're going through such a difficult time or an important time. So I would like to work for Mercy because for as long as I can remember, my family has always received healthcare through Mercy facilities. My grandmother received her cancer treatments through Mercy, as I previously mentioned. My sister received mental health services through Mercy. All the women in my family have their babies at Mercy. I was even born at Mercy. Um, and all the times I've spent just visiting my family members while they were in the hospital. I was always super impressed by how dedicated, how kind, how attentive all the nurses were, and they all worked together very well. And then that's only been confirmed to me since I've been working at Mercy's labor and delivery department with how awesome the staff is. And I've always strived to work for a place that I could be proud of, and I really feel like I could be with Mercy. So, over the next 5 years, it is obviously my goal to continue working on my skills and becoming a better nurse, obviously. Um, I hopefully on a labor and delivery floor because, as I mentioned previously, that is what I am most passionate about this far. And also, I really would like to further develop over the next 5 years my nursing intuition. And what I mean when I say that is I'm always so impressed when my preceptor knows something that's very obvious to her, but it seems so foreign to me. And I just hope to develop that intuition over the course of the next 5 years. And I also see myself going back to school eventually. However, I think I need to take some time off of school so that I can find what I truly love, find what I want to do with the rest of my career, and so on. So if you were to hire me, I believe that you would be gaining a very hardworking, a very dedicated, reliable, compassionate, and personable person. And I say that because I've been going to school full time for the past 4 years, and I've also been working a lot to support myself. And on top of that, I have a very big family, and with that comes many family obligations. Um, so I've always been very hardworking in that sense and reliable. I'm always there for whoever needs me. And then also, I feel like you'd be gaining a very personable person because of all my experience in customer service. I tend to connect with people and I enjoy connecting with people. So I really feel like I could bring that to your company. A very stressful time for me was when I was on a clinical site last semester. I was on a medical surgical floor. I was assigned a patient for the day who was known to be combative, known to be aggressive. Um, my nurse that I was precepting that day asked me to obtain this patient's blood sugar reading. When I walked into the patient's room, the patient was sleeping, and my nurse told me not to wake him because he rarely slept, and she said we should just let him sleep, and if he wakes up, he wakes up. So, against my better judgment, I walked into the room and I stood on the bedside opposite of the door, so I was away from the door, and I poked the patient's finger without waking him. He immediately jumped and he swung his fist at me, thankfully missing. But I remember being terrified because I had not taken the steps to protect myself and I had not taken the steps to give the patient the best care that I possibly could. I definitely should have woken him, and I also learned that it's important to prioritize my own safety as well as the patient's because I was if the patient were to get out of bed, I was on not on the side of the door, so that would have been a dangerous situation for me. So I really learned from that situation. So the patient population that draws me into Mercy St. Louis is the women, and when I say that, I mean um, Mercy St. Louis has always been known to me as the baby factory, and I know that sounds silly, but I just feel like everyone I know has their babies at Mercy St. Louis, and I think that's because they have such an outstanding labor and delivery department. I mean, they had the most childbirths out of everywhere in the region, I think, in 2020, which speaks to how great their quality of care is. And I really am drawn to caring for women. I feel like I relate to women. I really enjoy learning about the female anatomy and pregnancy and labor and postpartum. So that's ultimately what draws me to this facility. So I would say my best quality is that I am very productive in high stress situations. And when I say that, I mean I've been working in the restaurant industry since I was 16 years old, and it may not seem like a very stressful place to work, but I promise you it is. Um, there's always something going wrong, and I have become very good at telling myself to take a deep breath, think about what I want to do to address a problem, and I'm able to execute while still maintaining happy customers. And I think that's really important. And I think that speaks to my life in general as well. I keep myself very busy with school, work, family obligations. So it's important that I am still productive in high stress situations. So I definitely feel like that's one of my best qualities. And then also, something that I struggle with is I sometimes lack confidence when I'm trying a new skill. And when I say that, it is ultimately because we are going through nursing school during a pandemic, and we've gotten kicked out of some of our clinical sites just for COVID reasons. And so that's kind of removed some of my opportunities to learn some of the key nursing skills like inserting a Foley, starting an IV, blood draws, and so on. So sometimes now, while I'm in my senior synthesis and my nurse tells me to start an IV, I get kind of nervous. So what I've been doing to try to better myself with that is just reinforcing the education that we had in fundamentals and looking over my textbooks, and then also asking my preceptor or letting her know that I'm feeling kind of insecure about something, and she usually is super cool and walks me through it. But it's important that I address those insecurities head on so that they don't become a problem later on. So, a time that I failed, this was actually very recently. As mentioned previously, I sometimes lack confidence in some of the key nursing skills, and that's just because we've kind of had a lack of experience in the clinical setting just with COVID and everything. But last week, actually, I was assigned to start an IV on a pregnant woman, and I was super confident going into it. I knew what I was doing. I've started IVs before. I found a good vein, and I went ahead and inserted the needle into the patient's arm. She immediately screamed, and I did not get flashback right away, so I tried to manipulate the needle a little bit to see if I could find a vein, and with no luck, the mom eventually asked me to stop inserting the needle and let my preceptor take over. This was very disheartening for me because, first of all, I did not like that I was making the patient so uncomfortable. That's just not really what I want to do. She wasn't confident in my abilities, and then I wasn't confident in my abilities. So I'm trying to work on not taking that failure as like a total loss, because I did learn from it. Because like the next time I went in to start an IV, I was a little nervous at first, but then I reestablished my abilities. I know what I'm doing. It is sort of scary when you have someone yelling at you. It's just important to take a step back, realize it's okay to make mistakes, and not take them as total failures, as they're all learning opportunities. If I ever see something unethical going on with a coworker, I will always be the person who stands up and says something. That's just how I am. My sisters will tell you that. My coworkers at work will tell you that. If I see something that I don't think is right, then I will speak up. And I actually just recently had an experience during my internship on the medical oncology floor. One of the patients on the floor expired during the shift, and the patient's wife kept calling his nurse that day, and she always had a million questions for her. She called her several times that day, and I just remember the nurse like rolling her eyes and like talking badly about her to all the other nurses. And this kind of almost annoyed me because I she had no compassion for this woman. She was grieving, and she probably hadn't seen her husband in days because SSM's policy is no visitors right now with COVID. So she was not empathizing with the patient's wife like I would have thought she would have, and I had to say something, and I just had to remind her like that she was grieving, and that it's important that we show her empathy and meet whatever needs we can of hers. And I just really hope I never get to a place where I'm not numb to another person's emotions. So I always think it's very important to speak up when you see something unethical going on. And if you're not able to resolve the issue with them, then it's important to get maybe some management involved if it's affecting a patient's care or family member of a patient's care. So, one thing I did like about the SSM facility that I did my internship at was how well all of the nurses worked together. They were all able to help each other out and anticipate each other's needs. They were able to see if someone was busy and when they needed help. They had a good chemistry, a good flow to the unit per se. And I really hope to work in an environment like that where I can rely on my coworkers, and they can rely on me as well, because I think that's important not only to make all the nurses' lives easier, but also to make sure the patient is receiving great care. And then one thing I did not like about that internship was that I believe that the management was a little bit disorganized at times. When I say that, I mean I was supposed to be trained as a tech on the floor before the internship was over. However, they never scheduled me to do so. I didn't receive any new information until I personally reached out to them, and they essentially wanted me to start out as a tech without having any training, to which I was obviously not comfortable with. I wasn't fully comfortable in my abilities to know what to do in certain situations or the tech's duties, and I made that clear, and they wanted to schedule me right away, and I just wasn't comfortable with that, and that's ultimately why I decided not to pursue that job. So some questions that I have for you is, what would the training look like after I were to start? Like, how long would I be precepting, and would I be taking classes and so on? And also, what are you looking for in an employee? What do you think makes the most successful, best employees? And then when can I expect to hear back from you, or is there anything further you need from me? Um, but if not, I look forward to hearing back from you.